So, I will call the first speaker, Dr. Kushal Umesh Bhai Agrawal. Yes, welcome. Start your presentation.
Hello. Thank you, AIOC, for giving me this opportunity. I'm Dr. Kushal Agrawal. I'm Ocular Oncologist practicing in Ahmedabad, Gujarat. This presentation is from my fellowship time at Wells Eye Hospital. So, today my topic of presentation is ultra low dose radiotherapy in cytology proven primary uveal lymphoma. So, a background of my presentation is usually um, there is a trend of lymphoma being treated with the ultra low dose radiation. Traditionally, we treat any lymphoma with around 34 to 36 gray radiation, but recently mesenchymal lymphoma has been treated with the 4 gray of radiation instead of 36 gray radiation, and there is some evidence of orbital lymphoma being treated with 4 gray of radiation. So we implemented same thing in the uveal lymphoma. So purpose is to study effect of ultra low dose radiotherapy, which is also called boom boom radiotherapy, using 4 gray of radiation in patient with fine needle aspiration biopsy proven primary uveal lymphoma. It is retrospective interventional case series. 8 eyes of 8 consecutive patients with fine needle aspiration biopsy proven primary uveal lymphoma were included in the study. Patient with associated systemic lymphoma already treated with the external beam radiation or systemic immunochemotherapy were excluded. So each patient with the presumed diagnosis of choroidal lymphoma underwent 27 gauge needle assisted fine needle aspiration biopsy through transvitreal route, and on cytopathology, once it was confirmed to be lymphoma, patients were treated with the 4 gray of radiation. So total 8 patients were there, mean age of 66 years. Only choroidal involvement was present in 4 patients, while other patients were having ciliary body plus conjunctival involvement as well. FNAB confirmed diagnosis of choroidal lymphoma in all cases. This is one case when top images, all 3 images showing the pre-radiotherapy images, where you can see this infiltration of this fundus diffusely with the lymphoma cells, suspected lymphoma cells, and then when we pass OCT through that, you see classical lumpy bumpy appearance of the choroid, which is one of the classical OCT features of the lymphoma. And the choroid is diffusely thickened. You cannot even see surface of the sclera. And there is on ultrasound also there is diffuse choroidal thickening you see. So this patient was treated with the 4 gray of radiation, and you can see resolution of the lymphoma cells, and the choroid thickness is also reduced. The lumpy bumpy appearance has gone. You can see scleral shadow, and the ultrasound thickness is also reduced. So best corrected visual acuity at the end of the study improved from 20/50 to 20/30 with statistically significant p-value. And this orange line is showing number of eyes with the subretinal fluid at presentation, which has almost reduced at the end of the study, and also intraretinal fluid, which was 5 eyes, and that has been reduced with the study. And the ultrasound choroidal thickness, as you see in each case, has reduced significantly with the p-value of 0.03. It has reduced from 3.1 to 1.9 millimeter pre-radiotherapy and post-radiotherapy. So outcome measures were best corrected visual acuity improved from 20/50 to 20/30. Mean ultrasound choroidal thickness improved from 3.1 millimeter to 1.9 millimeter. And change in the cystoid, change in the central macular thickness at fovea with therapy improved from 371 to 263 microns. So each value was significant. So mean follow-up was 32.4 months. OCT surface undulation came to normal within 6.9 months. None of the patient had visual acuity loss greater than 3 lines post-radiation, and no major radiation complications were there in any patient. One patient had recurrence after 36 months, and this patient was treated with the standard dose radiation. So each patient was treated with the 4 gray radiation, and if patient is having any recurrence, then patient shifted to 30 gray radiation, and only one patient had this type of outcome. So we compared our study with the other published study. So Kaushik et al. And Ganam et al. Has published on lymphoma, and they all treated with 33 gray or 28 gray radiation, while we treated with the 4 gray of radiation. So we can see cataract, radiation retinopathy, and vision deterioration all were there present in their study, but none of the patient developed any complication in our study, but recurrence rate was high. But that can be managed with the increasing dose of radiation. So to conclude, ultra low dose radiation can be considered as a first line treatment with less side effects in patient with the primary uveal lymphoma, and recurrence can be treated with increasing dose of radiation. Thank you.
Okay. What is the normal thickness of choroid?
So choroid is usually 200 to 300 microns. So in our many of the cases it has like average was 3.1 millimeters. So it was diffuse choroidal thickening in case of the lymphoma.
So with minimum radiation of 4, you have not got any simple complication.
No, so we did not get any major complication like radiation papillopathy, radiation retinopathy. So we did not get, because it is a very low dose of radiation, and lymphoma cells are very like sensitive to radiation. That's why now there is a trend of treating lymphoma cells with ultra low dose radiation. Even mesenchymal lymphoma has been treated now with ultra low dose radiation, so to prevent radiation complications.
Which type of lymphoma you are getting more in your case?
Can you please repeat your question?
Which types of lymphomas you are having in all cases?
So primarily they were uveal lymphoma. Involvement of the choroid and ciliary body was the primary site, and some patients were associatedly having conjunctival lymphoma. We did not take any orbital lymphoma in our study. So primary was the uveal lymphoma.
Only the ciliary lymphomas you have treated?
Yes, yes, yes.
Had a conjunctival component.
Which component?
A conjunctival component.
2 patients were having
Two of these
conjunctival.
patients. So the biopsy was again from the uvea, or was it from the conjunctiva?
In that patient, we took from conjunctiva.
From the conjunctiva. Okay. The other thing is your follow-up range is quite large.
Yes.
So you have your first recurrence at 36 months, and your shortest follow-up is at 9 months.
Correct.
So, I mean, advocating boom radiotherapy.
Yes, sir. So still we are following these patients, and long-term result we will publish again,
Yeah,
sir.
because we were all very excited about boom radiotherapy. The problem is with the recurrences.
Yes, correct, sir.
Okay. Nice presentation.
Yeah.
Thank you.
Thank you.